Our mission here at Doylestown is to empower patients to live the best life that they can, and that is individualized to the patient. What my health and my goals are different from yours. And really what we do is, as an institution, not only rehab, we work together with the patient to come up with a plan and to really motivate you to make sure that you are living the best life that you can.
When you can tie into how their risk factors, their diet, their cholesterol test, their blood pressure, how all these things relate to their disease, now they're more motivated to changing their lifestyle, improving things. Whereas if you just told them the do's and don'ts, that works, but only for a month or so, and then they relapse. So I'm trying to create a permanent way to change their lifestyle.
Our goal is to make small incremental changes that lead to big health positive consequences. People hear me say it all the time that, we are really in this for the long haul. Small baby steps is the best approach to changing habits.
One of the big benefits of Doylestown Hospital and our therapy department is once patients come to us, they stay with us. So we don't want them to have to return, but if they have another issue in the future, they likely do return to us for further needs. And that's from the trust that we're able to build with our patients.
We treat everyone as if you're our own family member. We get to know you. We get to work on you one-on-one several times throughout the week. It could be up to several months. And we develop a relationship with you to make you achieve the goals that you are able to achieve. We are not an institution that just has people come back and back and back. We'll let you know when therapy has plateaued. Doylestown Hospital really has the mission to help people and to serve people. And that's evident if you walk through our doors and through our rehab department. You'll see people who are caring for people. The beauty of it is that everybody cares and everybody gets involved. Our rehab program is unique in that we are a multidisciplinary department that provides individualized care with a variety of specialists.
The fact that we can provide all of these specialties under one roof allows us to collaborate with each other. If a patient comes in and they have an issue that therapist isn't that comfortable with, they will openly collaborate with any part of the team in order to get the patient the best treatment that they need. This really creates an environment for healing. From the time that a patient walks in, our office staff is friendly. Patients sometimes are at their absolute worst one day post-operatively. And you see a smiling face, they're going to try to make you laugh. Having such a collaborative environment with all of the therapists really working together, even though we all specialize in different things, we really do all work as a team. And we're going to put all of our expertise together to make sure that everyone is treated as best that we possibly can.
The cardiac rehab program here understands that in addition to promoting and instructing patients on heart-healthy exercises, they understand that we need to look at the whole person, we need to look at their diet, we need to look at other lifestyle changes. And that's why they also refer their patients to our outpatient counseling centers, because they understand that the whole person is going to be part of the healing process.
One of the benefits of cardiac rehab, if you've had a heart attack or bypass surgery, it reduces the rate of readmission and mortality by 58%. Overall, cardiac rehab in a 5-year follow-up study has shown to reduce readmission rate by 42% and mortality by 42%. And I tell our patients, this is just cardiac rehab in general. Our program's better, so I hope that they'll receive even better results.
As a dietitian, we look at food as medicine. For some patients, that is a particular diet. For other patients, it's a different way of eating. But the ultimate goal is to eat in a way that gives your body good messages about how to heal, and to avoid those foods that are either not giving it any message at all, or they're giving it a message that is detrimental to our health. And we want to look at the whole person when we do this. We want to look at their sleep habits, where, the stress that may be in their lives, and really work with them on an individual basis when we can to promote change.
Our average age in cardiac rehab is 68, 69, so somewhere in there over the years. For that type of patient, typically walking, an upright bike, or a recumbent bike, again, whichever is best for the patient. We have recumbent ellipticals, upright ellipticals, so it all depends on where their fitness level is. We have some incredibly fit, patients in their 70s and 80s that will use a lot of that equipment. So it's not age, it's really how fit they are for their age with what determines the use of equipment. One of the big problems in cardiac rehab that I hear from my peers in the field is the lack of support with getting the best equipment. We are so blessed at Doylestown Hospital. We have a community group called Friends of the Heart. So if we need a piece of equipment, Friends of the Heart will purchase that piece of equipment for us. If you saw the equipment we had and visited any other program, you would be amazed at how much better our equipment selection is and the type of equipment we have. I'm very excited with what we can offer our patients versus other programs.
Doylestown Hospital, specifically the rehab, has been very lucky to have people that have supported our mission throughout the years. Over the past few years, we have moved to a state-of-the-art facility with state-of-the-art equipment.
We actually now have this space that we needed to have grown our clinic as much as possible. We are able to perform many areas of specialized treatment now, just due to the increase in space. Prior to moving to our new center, we were not able to perform pelvic health, pelvic floor therapy, because we just didn't have private rooms or a safe space for patients to be treated in that way. We were not able to perform therapy specific for Parkinson's disease, where you really do need space to treat. And we weren't able to have the amount of therapists that we needed to serve the community. So we had waiting lists, people were waiting for their therapies, and now we were able to really increase our staff from maybe 12 when I started to 26 now, where we really can serve the community as a whole with all the specialty areas under one roof. You don't need to go to different clinics for different specialty areas anymore because we house all of it right here at Doylestown. We maintain a high skill level for all of our therapists, and one way that we do that is we provide continuing education courses right here at our own facility. The new Levy conference room in our new building allows us to host conferences that are national. Therapists from all over the country come to these courses that are taught by highly skilled professionals. And we can do all of this at our own facility, which is great advertisement, but it also allows us to stay up to date on all of the different treatments that there are out there, as well as share with other therapists from other areas of, what are they doing at their facilities? That has really helped us to know what we need. If there's something that we hear someone else offers, we want to offer that here as well. Continuing education, making it so available for our therapists, is really what keeps us at a high caliber.
We do get patients from all over the area. However, a lot of them are community members, and people make friends coming to therapy, and therapists become friends with our patients. Our patients give us accolades all the time about how kind and caring and friendly our facility and our staff is. That starts from the beginning.
Every week, a patient seeks me out to tell me how great the program is, how professional the staff, how caring the staff is. And then when we discharge them, when we test, how proud they are of their accomplishments. I love it.
I love the quote by Michael Pollan, who is a food writer, where he says, "Eat food, smaller portions, mostly plant." eat food, not food like substances that are packaged in boxes. So more of a whole foods diet, much less of those ultra processed foods that are loaded with a lot of ingredients that are really not very healthy for us.
One simple thing we know from research is that if you're at least over 4,000 steps per day, you're starting to lessen the probability of disease. You're going to see a better outcome. And a lot of people, believe it or not, are well under 4,000 steps. So you'd want to be well over that. We know the best outcomes are at 8,000 steps or more. So our healthier, younger patients, we're going to push in that direction.
Everybody knows that they need to do exercise. Everybody knows they should take a walk. The hardest part is getting up and doing it. I often recommend that you find an exercise partner or a walking partner. That way, on the day where you don't feel like getting up, your partner is going to encourage you to get that exercise done for the day. It's always a better way to hold yourself accountable. Plus, the time goes by much faster when you have someone to converse with during your exercise.
It does not take a lot of money to do simple exercises. It can be as simple as doing arm lifts, leg lifts, standing at your kitchen counter and lifting up a leg. You always should check with your healthcare professionals before you start an exercise program, but there are a lot of simple exercises that you can do to maintain your mobility and your functioning as we get older.